Sashika Naidoo, who is from QIMR, Berkhofer, MRI, and presentation on ethics review, disruption, innovation, and advancement. Over to you.
Thank you very much. I'd like to begin by acknowledging the traditional owners of the land which I meet on, which is the Turrbal people, and pay my respects to their elders, past, present, and emerging. And I welcome all Aboriginal and everyone this afternoon on the call. So my presentation today is intended to be sort of a pragmatic lived experience discussion, and it is about what we've just emerged from. So it's a discussion on research ethics, review, disruption, innovation, and advancement. So this presentation will discuss changes in ethics review processes implemented during the pandemic, and we'll look at the lasting impact of this disruption. It will explore the lessons learned, the potential to work differently, and look to the future of ethics review. So for some of you who probably don't remember the last 3 years, it's been quite harrowing. It's been an unprecedented time for all of us across the globe. And this has all been caused by COVID-19, which is an infectious disease. It was first identified in Wuhan in China in December 2019. And as we all know, working in sort of the research and specifically medical research institutes, COVID-19 vaccines have reached consumers in record time. In order to do this, because normally vaccines take typically 10 to 15 years to reach market, vaccine developers condensed and compressed the clinical trial phases to generate the appropriate data to support applications by running clinical trials simultaneously. The Pfizer vaccine received emergency use authorization by December 2020. And between December 2020 and December 2021, 9 vaccines obtained emergency use listings with the World Health Organization. To date, approximately 12.97 billion doses have been administered globally. And from a research perspective of note, in February 2021, ethics approval at the Imperial College of London was granted for the first human challenge trial of COVID-19. The stats are quite profound. I had a brief look at them this morning, and to date, we have 16,000 deaths in Australia attributed to COVID-19. Additionally, we've had large numbers which fluctuate, and I think there are over 650 million cases globally of COVID. And I think my last recollection is 6.5 million COVID deaths globally. So I think let's move on to talk about the pandemic's impact. And I'm sure all of you are very familiar with what this is. From an ethics committee perspective and from a researcher perspective, we'll look at the different ways that this pandemic has affected us, but at the most basic human perspective, how did it impact us? Our interactions were virtual and it became the norm, and public spaces were essentially out of bounds. Half the world's students were affected by school closures, as were many of the parents. So there's been a shift in social interaction, connectedness, and cohesiveness. Our travel has been stunted severely. And for many of us who are migrants in this country, we've been unable to return until quite recently to visit with family and friends across the globe. So leisure spending across the globe fell. Food security, I'm sure all of you are all too familiar with the dashes to the supermarket prior to lockdowns, as well as the supply of food has been impacted. Food prices surged at the fastest pace ever, jumping nearly to 13%, which was a new record. Access to services, for basic services, as well as mental health, increased incidents of domestic violence, unemployment, underemployment. And let's talk about health and research, because how did it impact us in those spheres? Some of the challenges we faced in this area have been disruptions to the status of ongoing and current studies, protocol deviations of patients not being able or participants not being able to return to the sites, of research being secondary to primary healthcare, because during this pandemic, we needed access to clinical facilities. And then we had to work out the real cost to patients in terms of cessation of research. especially if participants were recruited to clinical trials that were ongoing and where the access to therapies or devices were potentially life-saving. Then was the flurry of COVID research and the funding that became available and the capacity for committees and for researchers to capitalize and work expediently to look at this global issue that we're facing. Then was the concerns regarding consent. In a socially distanced environment, we had to look at different ways of doing things. I think for countries like Australia, where we have quite good guidelines and procedures and policies, it was easier for us to pivot. However, for countries that are in developing countries, very often HREC chairpersons had to get together to come up with decisions about how to manage the situation. We had to also be able to work quite expediently without impacting the quality of review. Researchers were physically unable to attend laboratories. And then there was the concerns about financial goals and milestones because funding is allocated. And even though you may have people in the laboratory, if you are unable to attend the facility, this is an opportunity lost. There were global shortages as well as HR shortages. And then with this heightened virtual and online presence came the scare and threat of cyber attacks, and most especially for those working in COVID research. So what did the ethics committees, and I think that this diagram actually really very well describes the quandary that a lot of committees were in. They had to try and understand the research challenges during COVID, and it was somewhat of an ethical reorientation. So their ethical decision-making had to be based on the new social and environmental considerations. There had to be rapid and timeous review of ethics requests without compromising rigor and quality of review. Managing quorum requirements and availability of members was another consideration. The adoption of new technology for committees who had traditionally not worked electronically. So there was a thought and work process that was far different from the world prior to COVID. And then the very real issue of retaining members during COVID. So how do we recruit, retain, and train? And then the type of research that was coming through and the skill set required to review it and the scientific and technical competencies required on the committees. So how did ethics committees respond? I mean, we were very fortunate in that we had the clinical trial statements that were out to guide researchers as well as committees. So it was guiding HRECs, sponsors. So it was a clinical trial project reference group who came out with that statement. And fortunately, all departments of health, NHMRC and the TGA agreed on that. And that was definitely very instructive and directive. The World Health Organization had information out about COVID studies and how best to manage those. Essentially, our HRECs mobilized themselves to assess, evaluate, and problem solve. They pivoted from in-person to online meetings. They had systems that supported this and helped them accommodate this as the norm. The expedited review process for COVID-19 research was set up. Staff were able to be fast and expediently trained in processes, and there was an acceptance that protocol deviations would occur, that reviewing types of deviations and the contributing factors and doing a risk assessment was really important as opposed to the world we lived in pre-COVID. Committees empathized with clinicians, researchers, and more importantly, participants regarding the start of their care, their trials, and their research. Committees focused on the values of the national statement, and there was a fostering and promotion of international collaborations and research. We were more accessible as committees, more available, and more engaged. We assessed and provided training in a virtual environment. So I think some of these gains, we will look at how we move forward with them, because we did this in response to major disruption in work that was going on. But essentially, what we need to do is, what will we keep as we move forward? And was this disruption really a renaissance of sorts? So looking forward, we will adopt hybrid and virtual meetings as a standard of practice. Expedited review processes have been tested and refined, and I think we will continue to refine them. Expert scientific subcommittees that facilitate timely review. So I think that is something that we've invested quite a lot of time and effort in establishing, because we had a flurry of activities that were coming through, and it was quite evident that we needed vast skill sets that may not have existed on committees, especially in the area of infectious diseases. We offered, and probably are going to be able to offer, better training to our committee members in terms of how to deal with future pandemics. We've largely moved to digitalize, but that for organizations that are still needing further impetus, now is the time to do that. We will continue to develop benchmarks, new processes, look to national and international collaborators to refine our systems of better managing emergencies in the past. And we will have tools to assist our committees. But most importantly, I think what we have identified is that we are stronger together, and when we work collaboratively, that we are able to achieve and overcome anything. Thank you.
Okay, yes, we can all relive, that sort of pandemic experience, and in a way, some of that changes. I got to say, I mean, what I remember was March 2020 when I rang the NHMRC saying there's no guidance in terms of us moving to the ethics meeting online, and we provide. In terms of, I think at the time, Teams wasn't really sort of fully used, and I can't remember, I think we might have been using WebEx at the time. But anyway, and they said, yeah, that's fine. And then about 2 months later, there was a guidance came out. But the other thing to keep in mind is some of your slides that you, dot points you put on your slide there, it's already been done. For example, I remember was meeting Gordon at a meeting in the ARMS conference in Adelaide, and he said, I've got to dash off to chair my ethics meeting. And I thought, oh, are you flying back to Brisbane? And he said, no, I'm just dialing in. So some of that's already happening, and so I think in terms of the we've got the technology and process in place to do that. I'm interested to hear some of the tools that you mentioned, if there are any tools that you come across that actually help the ethics committee, and also, I guess, HREC coordinators that can actually use to help, the ethics to be on more of a hybrid setting.
Okay, so I think, yes, I agree with you that virtual options have always been available. Even though they have been available, they've not been accessed or utilized anywhere near as much as they've become mainstream. So I think the sort of generalizability of use is something that is become common, and it is something that I think we are going to have to appreciate, that members are going to want to access hybrid meetings. There is definitely benefits to in-person meetings, but there are other committees that have adopted hybrid meetings for a number of years. So I think we need to utilize the technologies available. I think from an HREC coordinator perspective, having good online systems where people can submit their applications and both the front and back end can be done in potentially real time would definitely minimize the contact time in situations where social distance is required. So having access to that. The other two things that I think are essential is having access to good quality scientific review, especially during emergencies where there are expedited timelines and turnarounds. Having the skills necessary on a human research ethics committee is invaluable. And I think as time progresses, we will identify more solutions and networking opportunities for shared knowledge in this space.
Yeah, it's funny you mentioned about the expertise. Our ID physicians never been so popular, with the work, and it's quite interesting to see. Also, I think your point about the expertise and how things change. For example, when there's trials on the intranasal spray, for example, so all of that comes into play. I suppose on the technology side, I'm probably just going to share as well our experience here at St. Vincent, the ability to, not only the online submission, that is, prior to that, again, we've got the system, but no one really using it. And the system, I mean, let's not go through the actual system itself and the challenges, but the ability for researchers to do their submission, but also for reviewers to actually do review online, provide the performer, and even things like, for example, our HREC secretary, doing the recording, as in the recording of meetings, and we actually have the transcript as well. Some of that, it's just been so useful. And from, I guess, my perspective as well, we save a lot of trees. It used to be like, we get, might be 15 studies, 3 copies each, at least 2, one for the professional, one for the lay. So a lot of trees been saved, I guess. But also the signing contracts and things that are happening online as well. So, certainly it's been quite useful to have the technology as well. Just checking the Q&A to see if there's any other question. If not, I'll ask the final one, but if I could ask the next speaker, Karen, to share the screen. So some of the, how do you see the ethics committee will be functioned in the next sort of 5-10 years? Do you see with this sort of technology, the ability to perhaps, combine a few different committees together and actually have that, sort of that collective expertise?
I definitely am of the view that with the use and utilization of technology, location is going to be less of an issue. And there is an opportunity for centralization and for specialized HRECs that have skill sets to look at specific types of research. So I think we will be moving to a central model, and that would be something I think a lot of researchers would appreciate in terms of consistency and sort of direction in terms of what their applications should look like, what the minimum expectations are. And as with any committee, there is diversity of thought and view. So unfortunately, it's not been something that we can codify and have an SOP in terms of what the committee feedback will be. But I think there will be more predictability in the process in a centralized model.
Great, thank you for that. Before I introduce the next speaker, let me just